I want to talk about dreams. Now, we dream every night, but we don't always remember it. And the question is, do dreams influence your health? And there are a lot of different theories on this. You know, over the course of a night, on average, we may dream 2 hours. I rarely remember my dreams.
Man, I always remember my dreams, and it's so fun. I come in and I get to tell you guys, and I'm like, what do they mean? As a matter of fact, last night I dreamt about a tall, faceless guy in blue scrubs chasing me, and he kept trying to give me a rose. I have no idea what does that mean? It was the most dramatic rose ceremony ever.
Sometimes it's your brain working things out. I've had dreams about patients and things like that. I had a dream where I had a patient in labor, and I dreamt that the baby was actually talking to me and told me to come to the hospital and deliver her, or I would miss it right then. So instead of calling the nurses and checking on the patient, I went right to the hospital, and the patient was right there ready, and I was right there ready to kiss the baby.
I had a dream where I put a breast implant on the back. I was like, true dream.
So what in the world does it all mean? Well, joining us on the phone is dream interpreter and the author of the new book, The Dream Power Journal, Cynthia Richmond. So, Cynthia, it's good to have you because we often dream, but we don't think about what does it mean for our health. So interpret what dreams mean for us.
Well, hello, doctors. It's so great to hear so much excitement and enthusiasm for our dreams. I'm so thrilled to talk with you this morning. But our dreams are a natural part of our life, and they do have a role to play in health and healing. The theory is that our subconscious mind knows the status of every cell in our body, and the way that the subconscious can then communicate is through intuition and through dreams. So if you have a dream that's health-related, it's certainly worth taking the time to explore it and see if there's something there for you to follow up on.
So, in other words, when you wake up in the morning, if you remember a particular dream, maybe it does say something about what's going on in your life. So, Jim, you were telling us about an interesting dream you had last night.
Somebody chasing you?
Yeah.
No, you know what? That's the other thing.
I had
Dreams
two
can
dreams
be kept between you and yourself.
Yeah.
You don't always have to share it with other people.
I hate those dreams where somebody's chasing you and you can't run.
Yeah, you can't run.
Now, what about Lisa's dream where the dream almost seemed to be speaking to her? Do you hear a lot of that kind of stuff?
Dr. Lisa's dream is really interesting to me. Expectant mothers have so many dreams. They dream, as Dr. Lisa said, the baby was actually speaking to her, and mothers sometimes have conversations with their baby. The baby might tell them what they want to be named and things like that, which is very intriguing. But expectant mothers will have dreams during specific periods of gestation about the foods or nutrients that that baby is needing during that specific time. And very often the dreams are very specific and, of course, sometimes symbolic, but in the case of expectant mothers, often very literal.
And I think the other thing that we should point out is that most dreams occur during REM, or rapid eye movement sleep. And if you're not taking the time and not making a commitment to sleeping at night, if you're cutting out those extra few hours of sleep, you may be cutting in to these episodes of sleep, REM, where you dream. And even if you don't remember your dreams, Cynthia, I think the take home here is that we should all be dreaming, whether or not we interpret them or not. Dreaming means you're sleeping well, and don't undermine how important that is for our health. Cynthia, thank you so much for joining us today.
Thank you, Dr. Travis. I enjoyed it very much.
Take care.